Americans who rely on Medicaid for health coverage will need to reapply for that this year. The U.S. Health and Human Services Secretary visited a clinic in North Minneapolis to highlight efforts to keep people covered. Here's John Croman.
At North Point Wellness in Minneapolis, they're seeing a lot of patients who put things off during the pandemic.
Chronic health conditions people deal with that have gone without much attention, so the diabetes, the hypertension, the heart failure, those things are less well controlled, and so now we are much more busy.
Medical Director Kevin Gilliam and Clinical Services Director Roshana Price-Isaac says people with access to health coverage should not let it lapse.
When that lapses, you might show up to your pharmacy and all of a sudden you're handed a large bill for your medications and you hand that back because it's like, I can't afford that. Then diabetes is uncontrolled, blood pressure is uncontrolled.
That's why they were glad to see Health and Human Services Secretary Javier Becerra hold a roundtable at North Point to highlight efforts to re-enroll all Medicaid users nationwide.
It could be as simple as responding to that piece of mail with your latest address, with basic personal information that'll keep you, your kids, your families insured.
There are 1.5 million Minnesotans enrolled in that health coverage, which is known as medical assistance in this state. They'll be receiving envelopes with a blue dot, reminding them they need to re-enroll this summer, and it must be done on paper.
Minnesotans can rest assured that all of their governments are working on their behalf to ensure that they are covered, regardless of where they live.
To me, I love to educate people on the why. Why do you need to fill out this paper, or why should you respond?
The folks at the North Point Wellness Center take more than just a passing interest in all of this. They have 100,000 visits each year by 36,000 different patients. In Minneapolis, John Croman, KARE 11 News.